Hello, my name is Dr. Bob Demaria, and I'd like to welcome you this evening to this awesome presentation that we're going to be having in reference to ADHD. My heart really goes out to you. Do you know that today in America there are 5 million children that have ADHD, and there are 8 million adults? Do you know I believe that ADHD kids have ADHD parents? You may say, well, geez, Dr. Bob, why is that? Because you eat from the same trough. In other words, you go through the same drive-thru, you eat the same commercial-grade peanut butter and jelly sandwich, you have the same breakfast cereal in the morning. So my goal today is to teach you what you need to know to make a difference in your life. Because see, unfortunately, the same physiology that causes ADHD will lead on to depression and eventually Alzheimer's and death. You may ask yourself, what is ADHD? How do I know if I had it? Well, I believe that much of the issue started in the late 1970s when the fast food industry went from using lard to hydrogenated or partially hydrogenated oils when they started making food. So they started cooking their French fries in this vegetable oil that was supposedly going to help lower a person's cholesterol. And then at the same time, many mothers started to go to work, and so they didn't really have an opportunity to cook and make food. So people started consuming convenience food, and children started having packaged food for breakfast, lunch, and dinner. Right now, today in our society, 1/3 of all the American children between 4 and 19 years old are going to eat at a fast food restaurant. And you're going to see why that is so significant in a very few moments. So as time has gone on in the 1980s and 1990s, in the year 2000, 2010, 2020, unless an individual makes a determination to change some of their normal everyday lifestyle habits, we'll continue to see an epidemic of ADHD, depression, and continued lower health. So I have put together this PowerPoint presentation to help you, the patient, to help you, the public, to help you, healthcare providers, anybody that has any involvement with dealing with children and or adults that have continuous, regular issues that are occurring inside of the body. I've written several books, and the book that we're going to be really focusing on tonight is Dr. Bob's Guide to Stop ADHD in 18 Days. This book was developed to help individuals, much like yourselves that are watching this presentation. I promise you, you'll see a huge difference. You're going to understand why it only takes 18 days. Now, let's just talk a little bit about ADHD, depression, Alzheimer's, and behavioral drugs. They can kill. It's a matter of life and death. What we have seen today is that individuals can die from these medications. And as you continue on with what happens inside of your body, it'll progress to a major issue like Alzheimer's and depression. So we're going to open your eyes to exactly what's going on inside of a person. The book, as I've talked to you about, is going to be Dr. Bob's Guide to Stop ADHD in 18 Days. 5 million kids. Do you know that every year in America, nearly 2 million kids attempt suicide? Some of the medications that these children take and some of the side effects include brain atrophy. That means that the brain is actually shrinking. Suicide, anxiety, weight loss, insomnia, addictive use of cocaine, which is very frightening, hair loss, skin rashes, nausea, dizziness, headaches, impaired movements, joint pain, and so much more. This is a very phenomenal piece of information that was released a couple years ago in reference to these psychoneurotic medications. The FDA released this report and said, the agency has asked the makers of 10 drugs to highlight the caution on their labels. The drugs of concern are all newer generation antidepressants like Prozac, Paxil, Zoloft, Effexor, Celexa, Remeron, Lexapro, Luvox, Serzone, and Wellbutrin. Most of them are known to affect the brain chemical serotonin. In our practice, on any given day, when there's an individual that comes in and is taking any type of antidepressant, today I see them taking 2. It frightens me, the number of young females that are under 30 years old that are taking Wellbutrin and Paxil, Wellbutrin and Prozac. And what these drugs do, they're called selected serotonin reuptake inhibitors. And what that means is that this chemical stops a brain hormone called serotonin to be reabsorbed inside of your body. But unfortunately, as time goes on, the threshold for this medication, serotonin, becomes more and more, so you need to take more and more of these medications. And the bad effects from this is devastating, what it's going to do to an individual. The government has encouraged people to stop using ADHD drugs. ADHD drugs can cause major health effects to individuals. These medications have very bad effects, and in some cases can even cause death. They're asking individuals to change the labeling. They want the labeling to say that these can have a risk and they can have psychotic involvement, and these individuals could have very, very bad and very negative side effects. ADHD drugs. The FDA reported that 25 deaths have occurred with cardiovascular disease in reference to these medications. Now imagine, you could have a child that is 2 or 3 years old, and if you're not exactly watching everything that they're going to and should be doing over time, and they become ADD or ADHD, and you take them to the healthcare provider, and they want to put them on an antidepressant, do you know that one of those side effects of that antidepressant could be death by suicide? Now I'm going to tell you, I have been doing very many book signings, and I've been doing presentations throughout the United States, and I had a mom come up to me after one of the presentations. She had an 8-year-old daughter. She had a tear in her eye. They had just put their 8-year-old daughter on Zoloft. I do radio throughout the United States. I did a radio program in Cincinnati, Ohio that went over the whole East Coast, and a dad from Michigan called up, and he was so upset because they put his daughter on an antidepressant. She was 12 years old, and she attempted suicide. So we have an epidemic that's occurring in America today, and this epidemic is giving kids medications, and these medications have not even been tested for these young children. A major, major issue and a major problem. The number 3 killer for teenagers is death by suicide. Every year, 1.8 million American children attempt to kill themselves. Now, we lived in a Mideast country, a third world country, I can understand that, but today in our society, kids have cell phones, and they have color TVs and air conditioning and access to unlimited electronic gadgetry. They have access to hot and cold running water. They have access to all the food they ever want. There is no reason for a child in America today to want to even think about killing themselves. Because you didn't know anything really about natural health care.
Nothing.
Actually, I remember you saying to me that you'd never even heard the word natural health care before.
That's right.
Which is quite interesting. And so what happened was we started with the program, and just briefly, the program that we followed was to have individuals stay away from snack food fats, hydrogenated fats, minimize dairy, minimize and eliminate sugar. We also made available to the participants some nutrients that they were to take, and I know that your family participated with that. So how long after that you started did you start to notice changes? Talk to me a little bit about that.
I noticed right away.
Like when you say right away, within a week?
Within a week.
That's very...
It was so obvious that everybody had definitely changed. Everyone was much calmer. We felt good. We had more energy. Everyone in the family.
So in a week's time period, you saw changes.
Yes.
Did you just want to flip out?
Yes, I did. Yes. And I stopped giving him the medication right away. Everyone had noticed a change in them, and they thought, "Wow, this Ritalin's really good stuff. You know, it's really changed him." And they said, "Oh, you put Christopher on it too. You know, you did the right thing for your children." And I said, "No, I took them off. I didn't put Christopher on, and I took Harry off, and we made lifestyle changes, and we're fine. We're doing good."
So what do you think might have been the biggest lifestyle change? I mean, going back, what do you think it was?
It was the fast food. It was mostly the fast food. We were addicted to fast food.
One of the interesting aspects of the book is I titled the book, Dr. Bob's Guide to Stop ADHD in 18 Days, is the fact that in 18 days you should see results. And the reason is that there's a fat in the body called cis fat, or the fat that we find in flax oil.